Hi, my name is Jennifer Robinson, and I will be presenting a snippet today of antihyperlipidemic drugs. Coronary atherosclerosis is the most common cause of cardiovascular disease in the United States. It's an abnormal accumulation of lipid and fatty substances and fibrous tissue in the lining of arterial blood vessel walls. Pathophysiology of atherosclerosis is the earliest visible lesion of atherosclerosis is the fatty streak, which is an accumulation of lipid-laden foam cells in the intimal layer of the artery. The hallmark for atherosclerosis is the atherosclerotic plaque, which is an evolution of the fatty streak and has three major components. The components are lipids, inflammatory and smooth muscle cells, a connective tissue matrix that may contain thrombi, and various stages of organization and calcium deposits. Some more pathophysiology. Atherosclerosis begins as monocytes and lipids enter the intima of an injured vessel. Smooth muscle cells, proliferate within the vessel wall, development of fatty accumulations and atheroma. As the plaque enlarges, the vessel narrows and the blood flow decreases. The plaque may rupture and a thrombus might form, obstructing blood. This will produce symptoms and complications according to the location and degree of the narrowing of the arterial lumen, thrombus formation, and obstruction of the blood flow. The primary symptom is going to be angina pectoris, which is typically or is secondary to myocardial ischemia. The H&G-CoA reductase inhibitors are also known as statins. They are antihyperlipidemic drugs. Mode of action, it lowers the elevated LDL cholesterol, inhibits the enzyme in the pathway of H&G-CoA reductase in the liver. Drug interactions is warfarin. Efficacy, the first line of treatments for patients with elevated risk for ASCVD. Safety, adverse effects are Malaysia, myopathy, and possibly rhabdomyolysis and hepatotoxicity. Average retail price, $15.90. Expected outcomes, we are wanting to lower the plasma cholesterol levels in all types of hyperlipidemias. Bile acid binding resins, also an antihyperlipidemic drug. Mode of action is the anion exchange resins bind negatively charged bile acids and bile salts in the small intestine. The resin bile acid complex is excreted in the feces, thus lowering the bile acid concentration. Drug interactions, digoxin, thyroid hormone, and warfarin again. Efficacy useful in treating primary hypercholesterolemia. Adverse effects are typically GI disturbances and bad taste. A lot of patients complain of bad taste taking these drugs. Average cost, $40.79. The expected outcomes lowers the LDL, slightly increases the HDL. The last thing that I do want to cover real quick is going to be the risk factors associated with high LDL levels. The major risk factors, associated with LDL are going to be smoking, hypertension, low HDL, family history of premature CAD, coronary artery disease, and age. Men 45 years of age and women, greater than 45 years, and women 55. Thank you.